Hello everyone, welcome back to my channel. Today's topic is again from medical surgical nursing. It is common geriatric problems and their management. So we will learn about what are geriatric problems, and then one by one we will discuss about geriatric problems and their management. Let's get started. This is a revision of anatomy of brain. To learn about geriatric problems, we need to first of all revise anatomy of the brain, which part is located on which side, and the defect on which part or degeneration on which part might lead to today's disease, that is dementia. Introduction to aging. Aging is a progressive universal decline. That means aging universally occurs in every human being. And as the age advances, there is universal decline in functional reserve. That means body function decreases as the age advances. Aging is heterogeneous. That means aging can be different for different people. It cannot be same for every people. Also, as the age advances, the risk of developing disease also increases. Geriatric giants means the main feature which is seen in geriatric patient. Main features which is seen in old age patient, that is immobility, instability, incontinence, and intellectual impairment. Immobility means mobility of their muscles and bones become less than other adults. Instability means both physical and psychological instability. They suffer from disease quickly, they suffer from infection quickly, old age people. That is, their body is less resistant to any kind of disease or any kind of infection as much as an adult's body is. Next is incontinence. Incontinence of urine might occur during geriatric period. That means involuntary passage of urine might occur because pelvic muscles are no longer able to work properly as it used to do in adult's body. Next is intellectual impairment. Decision making, reasoning, memory, association. These all might be disturbed in geriatric patient, which results in intellectual impairment. Common geriatric problems that we are going to discuss is first of all dementia, which will be today's topic. After that, urinary incontinence, which might be there in previous video. Fall injury and pressure ulcer will follow this video. Let's get started with dementia. So dementia is a syndrome, that is collection of symptoms in which there is decline in intellectual function, causing cognitive and functional impairment. Whatever decline is there, we will be learning in the features. But as an introduction, dementia is a syndrome of progressive decline in which multiple intellectual abilities deteriorate, causing both cognitive and functional impairment. Dementia is an impairment of memory, basically, and then of intellect, and then personality. But still, consciousness is not impaired. Consciousness is still intact. Dementia can also be said as a state of chronic confusion, while delirium is an acute confusion. Delirium is another state, another psychological dysfunction, which is a state of acute confusion. But in dementia, we have chronic confusion. This is a picture showing chronic confusion. Major characteristics of dementia can be disorientation, memory impairment, paranoia, hallucination, emotion unstable, and sleep-wake cycle reversal. Disorientation to the environment is followed by memory impairment. Recent memory is disturbed, but remote memory can be intact. Paranoia or paranoid can be defined as a person who has multiple doubts on others. Others means others, whoever is there in the family, in the environment. Hallucination is hearing something or seeing something which is not actually present there. Emotion unstable means going through a flow of unstable emotions continuously. Sleep-wake cycle reversal means the time of rest they tend to wake up, and the time daytime or the time for activities, they tend to sleep. That is sleep-wake cycle reversal. This is a picture for dementia characterizing degeneration of tissues, brain cells. Dementia was described as a mental illness by Dr. Alzheimer, who is a German neuropathologist, who described this disease as a disease in the brain or changes in the brain caused by vascular disease. It commonly occurs in elder people or old age people, then in the middle age group and young adults. Etiology of dementia: significant loss of neurons of the brain due to any cause. Environmental factors like infection, for a long time untreated infection can cause dementia. Metals, when the metals are exposed in the body, harmful toxic metals are exposed in the body, that can cause dementia. Toxins, anything that is toxic to the blood, if exposed to the body for a long time, can cause dementia. Excessive amount of metals such as zinc in the brain. Brain does not require too much amount of many metals. If that is present in excessive amount, that might cause dementia. Nutritional deficiency such as deficiency of vitamin B6, vitamin B12, and increased level of homocysteine. Also, depression at an early age may be an etiology that leads to degeneration of brain cells quicker. There are untreatable and irreversible causes of dementia, which are degenerating disorders of CNS, Alzheimer's disease, Pick's disease, Huntington's, and Parkinson's disease. Degenerating disorders means any neuropathological disorders that causes degeneration of the brain cells. Alzheimer's disease is typically the type of dementia in which there is memory loss and intellectual dysfunction. This is Pick's disease. In Pick's disease, there is a degeneration of the frontal and temporal lobes. Pink is frontal, green is a sign for temporal lobes. In Huntington's disease, there is enlargement of the frontal part of lateral ventricles of the brain. There is a comparison between normal brain and Huntington's disease. Common symptoms of Huntington's disease are mood swings, cognitive decline, involuntary movements, flappy movements, hallucination, speech difficulty, and personality changes. Also, Parkinson's disease. This is more common name that we tend to hear. In Parkinson's disease, there is loss of dopamine. So, loss of dopaminergic neurons in the substantia nigra might lead to a disease called as dementia. These are the reversible etiology of dementia. Reversible, which can be treated. They are vascular multi-infarct dementia, intracranial space occupying lesions, metabolic disorders such as hepatic failure, renal failure, infections such as AIDS, meningitis, encephalitis, intoxication with heavy metals like zinc, too much in the brain, or intoxication with alcohol. These are the reversible etiology, whereas irreversible etiology can be those disease like Parkinson, this is like Pick's disease, in which there is severe effect to the brain. Now, types of dementia are cortical dementia, subcortical dementia, progressive, primary, and secondary dementia. In cortical dementia, there is damage to the cortex. So, cortex part controls memory, language, social behavior. There is harm to all these things: memory, language, social behavior. Subcortical part lies below the cortex. It causes change in emotion and movement in addition to problem with memory. Along with memory problems, social behavior problems, there is change in emotion also because subcortical part of the brain is involved. Progressive dementia. Progressive dementia gets worse over time and it interferes with cognitive abilities, able to think, able to reason, able to make decisions, all that. Primary dementia is caused by dementia which is called as Alzheimer's disease. Primary dementia is caused by actually Alzheimer's disease that does not result in the form of any other disease. Secondary dementia is dementia that occurs as a result of physical disease or injury to the brain. If there is any head injury, if there is any trauma to the brain, then that might cause secondary dementia. There are stages of dementia. There is early stage, stage 1, middle stage, stage 2, and final stage, stage 3. In stage 1, it might exist for 2 to 4 years and symptoms develop gradually. It does not develop overnight. Okay, symptoms develop gradually. That's why sometimes we might not be able to become sure of signs and symptoms. Features are forgetfulness, declining interest in the environment, hesitancy in doing any, performing anything or initiating any action, also poor performance at work. Stage 2 is middle stage, which is between 2 to 12 years. There is progressive memory loss, hesitation in response to question. That means if you try to obtain history, if you ask something, patient is hesitant to answer. Has difficulty in following simple instruction like get up, sit down, have this. Patient is irritable and anxious about everything, wandering here and there, neglects personal hygiene because cognition is affected. Also, patient becomes socially isolated as patient is not able to communicate with anyone. Final stage might last up to year. Year 2, symptoms develop gradually. Step by step, it becomes worsened. There is marked loss of weight because inadequate intake of food. All this is because dysfunction of the brain and its part. Patient is unable to communicate now. Now patient is not able to recognize family member also. And then there is incontinence of urine and feces. Both the urine and stool passes involuntarily. Patient has no control over that. Patient also loses ability to stand and walk. That not being able to stand and walk is because brain is not able to control those functions. Death at the last, if death occurs, it is caused by aspiration pneumonia. Lungs, the muscles of the lungs are also not able to receive proper message from the brain. So death can be caused by aspiration pneumonia. There are 10 warning signs of Alzheimer's dementia. This is very important for exam. These each one symptoms or signs can be the sign which, if seen in any patient, if seen in patient even of stage 1 or stage 2 or any stage, should be taken to hospital immediately, because these are the signs that denotes that patient needs immediate treatment. Memory loss, difficulty in performing familiar tasks, problem with language, disorientation to time and place, poor or decreased judgment, problem with abstract thinking, misplacing things, changes in mood or behavior, change in personality, and loss of initiative for anything. Clinical features for dementia can be, first of all, personality changes, lack of interest in day-to-day activities, easy mental fatigue, self-centered, withdrawn, decreased self-care. That brings to personality changes. Memory impairment. Recent memory is affected. Patient does not remember what she had for breakfast, but she remembers who was the best friend or best teacher during school. Cognitive impairment includes many things: disorientation, poor judgment, difficulty in abstraction, decreased attention span towards anything. Affective impairment is emotion impairment, that is labile mood, irritableness, and depression. Behavioral management. Now, how patient manages the behavior or performs the activity comes under behavioral management. That includes stereotype behavior, alteration in sexual drive, and also psychotic behavior. Patient changes the behavior pattern, and however, patient manages his or her activity by changing this pattern. Sometimes there is disturbance in cognition, sometimes there is difference in sexual activity, or sometimes difference in sleep-wake cycle. Next is diagnostic test. There is cognitive assessment evaluation, functional dementia scale, MRI, spinal fluid analysis. All these diagnostic tests, one way or the other, helps to determine either structure of brain or function of brain. By performing MRI, we can know what is the change in structure of the brain. By that, we can find out is there degeneration occurring in the brain cells. By performing spinal fluid analysis, we can find out whether there is beta amyloid deposit in the brain cells or not. If there is, then that might be a sign of serious disease in the brain. Along with dementia, there also might be risk of other disease if there is beta amyloid deposits in the cerebrospinal fluid. To manage it medically, we have NMDA antagonist, memantine. Antipsychotic agents can be given because patients with dementia suffer from depression. So suffer with depression or suffer with hallucination, all these symptoms. Antipsychotic agent is for that. We have nursing management. A nurse can perform many activities for a dementia patient. Some of them can be, first of all, nurse should assess. There should be a MSE, mental status examination. Status about orientation, mood, suspiciousness, paranoia, self-care deficit, sleep disturbances, hormonal cycle, activity pattern. These all should be noted down so that we can obtain a baseline data about the patient. After that, nurse should set up a daily routine to make the patient busy or involved in activities so that patient can feel a sense of responsibility towards the environment. Also, there is in the third stage, if we remember, there was change in the weight, alteration in the weight. So nutritional status should be checked, like anthropometric measurement can be done or dietary assessment can be done. Nutritional status should be measured to find out whether there is a nutritional deficiency existing in the patient or is there any risk. Disturbed sleep pattern should be managed because brain can function properly only in a well-rested body. Accidents should be prevented. Patient's bed rails should be elevated because at the late stage, there are involuntary movement occurring in the patient. And being disoriented to the environment, if they fall down, that might result in another injury. Patient who have delusion and hallucination should be monitored on daily basis. Like what are they hearing? Who are they talking to? What are they believing? These all things should be monitored. Also, patient having hallucination and delusion are at risk of suicide. So they should be monitored regularly. Thank you so much. Next topic in this geriatric problems will be discussed in next video.